So hello friends, in this video we are going to discuss about one of the most important topic of the inherited bleeding disorder, that is one Willebrand disease. Okay, so first point is that one Willebrand disease is your most common inherited bleeding disorder. Okay, it is the most common inherited bleeding disorder. The first point you have to remember that. Now, one Willebrand factor. First, we will talk about one Willebrand factor roles. Then we will go in pathology. So, one Willebrand factor has two basic roles. Okay, the first role is platelet adhesion. Okay, it acts as bridge between exposed subendothelium and platelet. The second function or the second role of one Willebrand factor, that it acts as binding protein for your factor 8. Okay, it acts as binding protein for factor 8, resulting the prolongation of factor 8 in circulation. Okay, it is just engaging T half of factor 8 in circulation. Clear? So these are the two basic functions you have to remember. This is very important. Okay, that is platelet adhesion, then factor 8 prolongation. Okay, now most of the symptoms of one Willebrand disease are your platelet like. Okay, except in more severe one Willebrand disease, when factor 8 is low enough to produce symptoms which are similar to those found in factor 8 deficiency. Okay, so in mild form, okay, you will get the symptoms like platelet deficiency, and in severe form you will get the symptoms like factor 8 deficiency. Clear? So this is the basic introduction. Now we are moving for the classification. Okay, on the basis of the qualitative defect or quantitative defect, the one Willebrand disease is classified. So remember the type 1 classification and your type 3. This type 1 and type 3 is basically quantitative classification. Type 1 and type 3 is example of quantitative classification. Okay, this type 1 is partial quantitative one Willebrand deficiency, and this type 3 is severe quantitative absence of one Willebrand factor. Okay, so type 3 is severe form and type 1 is your partial deficiency. Clear? Now type 2a, type 2b and type 2m, these three are qualitative defects. Okay, these three are qualitative defects. Clear? These three are qualitative defects. Now this type 2a is qualitative one Willebrand factor defect. This type 2b is qualitative one Willebrand factor defect plus increased one Willebrand factor platelet interaction is seen in this. Then this in this 2m type, okay, there will be same, that is qualitative one Willebrand factor defect plus decrease one Willebrand factor platelet interaction. Okay, here there will be decrease one Willebrand factor. Okay, now decrease interaction is seen in 2m. Now one more point, that type 3 is only autosomal recessive, rest all are autosomal dominant. Remember this, rest all type 1, type 2a, type 2b, type 2m, all are autosomal dominant except your type 3. Type 3 is generally autosomal recessive. Clear? In all of these, factor 8 activity is lowered. Okay, and much more lowered in 3. Okay, much more lowered in 3, and in all the factor 8 activity is lowered in all, but maximum lowered in type 3. Getting? Okay, so and one Willebrand factor activity is maximally lowered in your type 3 and type 2a and type 2b and type 2b. Okay, so type 3, type 2a, type 2b, type 2m, lowering is same in case of one Willebrand factor activity, but in type 1 there is no such lowering of the one Willebrand factor activity. Clear? So this is some important points. Now this is the classification. Now we are moving for the next, that is your okay, one or 2 point mainly, it is type 1 disease is due to mutation mainly. Okay, type 3 disease is due to deletion or sometimes due to frame shift mutation, and this type 2 is due to missense mutation. Okay friends, now moving for the acquired one Willebrand disease. So acquired bone weight is very rare disorder, okay, and it is most commonly seen in patient with underlying lymphoproliferative disorder, okay, which includes your MGUS, that is monoclonal gammopathies of underdetermined significance, then multiple myeloma, okay, then your Waldenstrom's macroglobulinemia, okay. So acquired bone weight disease is very rare disorder, and it is seen in patient which is suffering from lymphoproliferative disorder or multiple myeloma or Waldenstrom's macroglobulinemia. It is also associated with patient of aortic valvular disease, okay. Now it is also seen in patient with Headache syndrome. So what is Headache syndrome? So it includes aortic stenosis with GIT bleeding, okay, that is known as Headache syndrome. So this is about acquired bone weight disease. Now coming for the treatment of the von Willebrand disease, okay, that is treatment. So the treatment of choice for type 1 Willebrand disease is drug, that is desmopressin, okay, desmopressin is the treatment of choice, clear. This desmopressin will cause release of von Willebrand factor and factor 8 from endothelial stores, clear friends. Now, and the route of administration is your IV route or nasal route, okay, and in through IV route the peak activity will be attained in 30 minutes, and in nasal route it will take 2 hours, and it is given in form of 2 squirts is given, 1 in each nostrils for person more than 50 kg, and for person less than 50 kg only 1 squirt is used, clear. And through IV the dose is 0.3 microgram per kg, clear. Now what is the side effect? The most common side effect you will encounter is hyponatremia when you will administer this drug, okay. This question is also asked. The side effect is hyponatremia due to decreased free water clearance, so fluid restrictions should be advised for all those patients for 24 hours after following each dose of this drug, clear. So this is important point, you must note down. Now moving to the next, that is type 3 disease, and for type 2 diseases, okay, the main is your von Willebrand factor replacement. Von Willebrand factor replacement can be given for this type 3 disease and for major procedures in type 2A and type 2M. And this von Willebrand factor replacement can be through virally inactivated von Willebrand factor containing factor or cryoprecipitated. Both can be used as a displacement. Then you can also use antifibrinolytic therapy, okay, you can also use antifibrinolytic therapy. In that you will give epsilon aminocaproic acid, or you can give tranexamic acid. So either of these two, either you will give epsilon aminocaproic acid, or you can give tranexamic acid, clear. Either of these two you can give to the patient, epsilon aminocaproic acid or tranexamic acid, clear. It will lead to the prevention of the bleeding, okay. Now this is contraindicated, this antifibrinolytic drug is contraindicated in upper urinary tract bleeding, okay. This is contraindicated in upper urinary tract bleeding due to risk of ureteral obstruction. So this is about the treatment. We have forgotten the diagnosis, so let's discuss about the diagnosis. So diagnosis is, the first is CBC, okay, usually normally involved diseases, okay. If heavy bleeding present, then hemoglobin level may fall. The second is your APTT test, that is activated partial thermoplastic time, because it checks the clotting of factor 8, factor 9, factor 11, factor 12, and it is normal in mild von Willebrand disease. Then you will also test PT test, okay. Now important tests which are important for diagnosis of von Willebrand factor, that is your first is your factor 8 clotting activity, okay. Factor 8 clotting activity, that is to measure the amount of factor 8 in blood. Then your von Willebrand factor antigen to measure the amount of von Willebrand factor in blood. Then the most important, that is ristocetin cofactor test. Ristocetin cofactor test, it is to measure how well is the 1 billion factor works. Okay, so this is important MC question also asked. Then 1 billion factor multimers to measure the makeup or structure of 1 billion factor. Then your platelet aggregation test. So this is all about your 1 billion disease. In next video we will discuss about hemophilia. So thank you for watching.